On today's birth story episode, Debbie talks about her experience getting pregnant after infertility, as well as changing from a physician to midwife care. Welcome to the All About Pregnancy and Birth podcast. I'm your host, Dr. Nicole Calloway Rankins, a board-certified OB GYN physician, certified integrative health coach, and creator of the Birth Preparation Course, an online childbirth education class that will leave you feeling knowledgeable, prepared, confident, and empowered going into your birth. Quick note, this podcast is for educational purposes only, and it's not a substitute for medical advice. See the full disclaimer at ncrcoaching.com/disclaimer. Hello, and welcome to another episode of the podcast, episode number 29. Thank you for being here. Today we have a birth story episode, and it is a good one. Debbie DiazGranados shares her unique story of pregnancy after infertility, which you're going to love that part, as well as how she decided to transition her care from a physician to a midwife. She also talks about what she wishes would have gone differently with her birth, as well as some great advice for expectant moms about reflecting on their own pregnancy and birth wishes. Debbie has a really calm and peaceful nature, at least that's what I felt talking to her. So I know you're going to enjoy this episode. But before we get into the episode, I have an important announcement to make. 2 weeks from today, on Tuesday, July 30th, I am doing a live online class on how to make your birth plan. So I will be there to teach you how to approach the process of making your birth plan, the questions you need to ask, tips to get your doctor to pay attention, and what to include. This is going to be packed full of useful information to help you for your birth. And since I'm live, I'll be able to answer your questions right there on the spot. Now, if you can't make it live, then register anyway, and I'll send you the replay. But I will encourage you to be there live because I have something special I'm sharing that you can only get if you're there with me live. So go to ncrcoaching.com/register to sign up, and that link will be in the show notes. There are a limited number of spots for this live online class, so go ahead and sign up today so you don't miss out on a spot. That's ncrcoaching.com/register. Okay, without further ado, let's get into Debbie's birth story. And FYI, I did kind of bleep out the names of the hospitals just because I have to be careful about that kind of stuff. Okay, let's get into Debbie's birth story. So, hey, Debbie, thank you so much for agreeing to be on the podcast today. I'm super excited to have you here.
I'm excited to talk to you about the birth of our child.
Awesome. Well, why don't we start off by having you tell us a little bit about you and your family?
Okay, so pre-child, it's my husband and I. We have been married since 2011, so I'm doing math quickly. 8 years. 8 years. We met in graduate school and moved to Richmond postgraduate school in 2011 and got married that same year. Graduated graduate school and got married that same year.
That's a lot in 1 year.
Yes, it is a lot.
Good things, though. Good things.
Right.
Yeah.
And we, didn't think we were going to be in Richmond for that long, but have fallen in love with it. And since then, I've bought a house and I've had a son.
Awesome. So why don't we just hop right on in and then talk about, your pregnancy and your birth. I know you mentioned that this pregnancy was after infertility. Can you share a little bit with us about your infertility journey and what that was like for you?
Sure. So I am older. Obviously anything over 35 is considered a mature maternal age. And so when we got married, we didn't necessarily think that we were going to have kids. It wasn't necessarily the top of our list. But after a few years, we started thinking about it, and we thought, okay, well, we'll throw caution to the wind, and if it happens, perfect. If it doesn't, we are okay with that decision.
Right.
And after a couple of years, and then towards the end of those couple of years, talking to my doctor and she's suggesting to do the ovulation kits and nothing ever panning out, we said, well, let's just, because at that time I'm even older. So I talked to my doctor and she said, well, you could talk to a specialist if you like. And kind of that was the beginning, I think, of our journey, if you will, of having a child. I think in terms of what was going on when I would take the ovulation kits, I was getting essentially some crazy data in which I would be ovulating for 8 days.
Oh,
'Cause,
wow.
yeah, positive tests for that long. So then, it's at first when you don't realize that that's not what's supposed to happen.
Right.
I was thinking, okay, well then this should be happening, sooner. But after,
Right.
several months, then realizing and in conversation with my doctor, made the decision to go see a specialist. So we saw a specialist in Richmond. He was fantastic, and we went in really just kind of saying, what are the odds? We both have PhD degrees, so we tend to kind of overthink and overanalyze. But we went into the conversation with the specialist, knowing that we didn't necessarily want to go the IVF route, but
Okay.
having a discussion of what can we do? What are some low intervention, low intervention type things that we could potentially do to help our odds?
Right.
Or at the same time, if our odds are really low for whatever reason, we just kind of want to know that too.
Gotcha.
So we wanted some data, I guess, essentially to help us kind of not make our decision, but kind of understand what was happening, since it wasn't happening kind of naturally or organically like we had thought it might.
Right. Because you guys are scientists at heart, so you need some data.
Right. So as we start talking to specialists, he's fantastic. He, mentions some things, mentions acupuncture. He does, lots of blood work, lots of ultrasounds, identifies that I have and I forget if it was a cyst or a polyp or something, but something that had to be removed from somewhere. I assume my uterus. I can't remember his
Right.
explanation was.
Yeah. Yeah.
His explanation was, you have something that is taking up space.
Gotcha. So
And
it's probably a polyp inside the uterus and maybe preventing a pregnancy from implanting.
Yes, exactly. So we had that procedure done, no problems at all. And, still doing tests, blood work, kind of every now, like almost at every month cycle, just doing blood work to see, what's happening with my levels. And my, husband also getting kind of producing a sample to see what's going on with his sperm. And we did, he put me on some birth control to, I think, to try to regulate kind of my cycle or my levels. I didn't necessarily do well on that because I then got at least signs that could have been a blood clot starting.
Oh, goodness.
So stopped that immediately. And then he put me on some patches, and I was doing the patches, I believe, and I went in for an ultrasound. And, and every time we'd go in, we said, doc, we just, don't sugarcoat anything. If it's really not going to happen, then just let us know. And at this appointment, he said, at the prior appointment, I think he had told me about acupuncture, and I hadn't started it. And he had mentioned it again during that time, or maybe I brought it up.
Right. And that's pretty cool that he went, was offering you this like less invasive approach. Not a lot of doctors do that.
Right. No, he's fantastic. He really does collaborate with an acupuncturist here in Richmond. And he mentioned it again. I said, well, I haven't tried it, but, I'm going to. So I just started going to acupuncture, but maybe like one visit. And I went in for an ultrasound, and he's doing the exam, and he was like, Debbie, I don't know that this is really going to happen. Like I'm just, whatever, however he said it, but that's the message I heard.
Right.
And, he said, whatever it was, whether it was low egg count or, he didn't think it was going to happen unless it was through IVF.
Okay.
And I was like, okay, well, like that's not necessarily the route that we wanted to go.
Right.
And it was upsetting. But he said, but, just, and I think in whatever conversation we had at the end of it, he just said, well, just keep doing the acupuncture, and by the next cycle, you're going to, do the patch thing again, and then come back again. And it was like a month or 5 weeks or whatever it was.
Okay.
And the next time, so I come home and talk to my husband, and, we're again dead set. We're not going to do IVF, but I said, okay, but I'm just going to still kind of follow through with this suggestion by the doctor to go see him again. So we go back and he does an ultrasound. He's like, Debbie, this is a completely different story. We can do, I hadn't communicated to him that we weren't going to do IVF.
Right.
It was like, this is a completely different story. You have, some good number of eggs that are follicles that I think we're going to be releasing an egg or whatever.
Okay.
Or potential, whatever the technical is. And he said, we can do IVF tomorrow.
Oh.
And, again, we hadn't communicated that we didn't want to do IVF. And we were like, hold the horses.
Right.
We had already kind of, gone through that difficult discussion of, I guess it's not going to happen for us. We're okay with it. But we're, now you're telling us that, because I think even at the time he was saying this is going to be a really low chance, like very low chance without IVF. And even with IVF, it's going to be kind of you're not risky, but,
a low chance. Right.
But now this time he's like, this is a completely different story. You have all, there's so much here that could be that are very viable and very, very good. We can do IVF tomorrow and the chances are really good. It looks, the picture's different, chances are better. And my husband and I we're just like, we can't flip our decision just like that.
Exactly.
And he said, okay, well, then you might want to get some candles and have a romantic weekend this weekend.
Right.
And that's how it happened.
Wow. Okay. Yeah. That's a cool story.
I love that story.
I love that story too. Yeah.
So I truly believe, obviously I think it was a combination of the patches, but the acupuncture, and it was, I love that. I love telling that story.
Right. Well, that is awesome.
Obviously, because, also the thing is that it could have also not happened,
Right.
It's such a, 1 in a million chance that even after that news, after that kind of picture and having that romantic weekend, that it could have just not happened, but it did. And it's pretty awesome.
Well, good for you. So you found out you were pregnant. Yay. And congrats. I can imagine that was a very happy moment for you guys, because it had been like 2.5, 3 years.
So that was in roughly August of 2015. So yeah, at least 2 years.
Okay.
If not almost 2.5.
Right. Mm-hmm. So what was your prenatal care like, just getting more towards the birth? Did you see a physician or a midwife, and how did you feel about the care you received during your pregnancy?
Started off, I had an OB, because I had a doctor that was doing all my well visits.
Right.
So, she was awesome, because she actually called me, I guess it was post a blood test. She called me on a Friday night to kind of confirm it. And, she was great. So as I was going to see her, and I kept kind of wanting to talk about, what I think I wanted, I was still kind of reading and wanted natural, wanted, just wanted to talk about it. She was very, very, I don't want to say insistent, but she just kept bringing up the fact that, okay, yeah, we'll talk about it later. Like, I don't know that we need to talk about it right now.
Right.
And then always bringing up the possibility of a C-section. And reflecting on it now, it might have been her way of trying to make sure that I wasn't like dead set on a certain way.
Okay.
And not being okay if it went the C-section route.
Right.
But the way that she was conveying that information, I wasn't getting that message at the time.
Gotcha.
So then I started to, and I think, early on, I have a friend of mine, even before we got pregnant, had told me about a doula. So I was definitely set on having a doula, because I remember asking her about, I want to get a doula, and she gave me some names or people that we could call in Richmond. So she was supportive of that. But then again, she kept kind of referencing the C-section. And so as I'm reading more about doulas, and then kind of understanding and finally select a doula, talking to her about kind of what I want, and then kind of hearing more about what's happening in the community here in Richmond with midwives and doulas. Started looking at the midwife program and then, kind of interviewed both midwives, and it was one of the most emotional. It was very emotional, because I finally felt like, obviously overloaded with hormones and emotions in that sense, but I finally felt like I was being heard in terms of what I wanted,
Gotcha.
or, what I wanted to try to have in
Right.
terms of a birth.
Right.
And then it was emotional because I remember crying in their office and they were crying with me. And it was a really just great conversation. And finally,
Yeah.
like, feeling like, okay, now somebody's getting it. Somebody's
Yes.
supporting kind of what it is that I want,
Right.
which then made me feel like I don't know if I can have my physician involved anymore.
Okay.
So at that time, the best decision for me at the time was to go with midwives, because I wanted to get that connection with the midwives.
Gotcha. During your prenatal care.
Right, during the
Okay.
prenatal care.
Okay.
So it was I think I made that decision. No, I know I made that decision. It was in February. And my son was born in May. So
Oh, wow.
yeah, it was a late decision to make, but I made the decision to switch from my physician to the midwife care.
Okay. Did you have any trouble doing that switch? Sometimes people get trouble when they try to switch later in pregnancy. It's harder.
No, in the midwife that I spoke with, who ended up being there with the delivery of my son, we spoke about that, and she said, "Oh, well, you're kind of late in terms of getting this benefit of these centering groups, but if you're okay with that, we're okay with you coming over and starting your prenatal care with us at that time." And so it wasn't a problem. They're very supportive about it.
Okay, awesome. And then you felt like the rest of your prenatal care there was still smooth and supportive, like what you were looking for?
Yes, very, very smooth, very supportive. Smooth, in the sense of there was always, because I was of advanced maternal age, there was the extra ultrasound here, the concern here that the baby wasn't growing, but we had, another extra ultrasound. But it was smooth other than that.
Okay, awesome.
Mhm.
Now, you mentioned that you had a doula. At what point did your doula get involved in your care?
So we selected our doula before we made that switch to the midwife, because I remember talking to her a lot about it.
Got it. So you were maybe a little over halfway through?
Okay, let's see. We got pregnant roughly in August. I think we had selected the doula before the first of the year.
Okay. Okay. And were you in contact with her? Obviously you were, but how much were you in contact with her, I guess, during the prenatal care? I guess I'm asking because in my mind, I'm very supportive of doulas, but I had this sense that, they just kind of mostly came for the delivery. You maybe had like one or two conversations beforehand, but I'm finding that women can actually connect with their doulas a lot earlier.
Yes. So it actually ended up being that we selected a doula who was a friend of, we knew her husband.
Oh, okay.
And not knowing that she was a doula at the time, and we had interviewed a couple of doulas and then interviewed her, or had a conversation with her, and she was just, it's funny because I feel like if I would, not that I wouldn't select her now if we would have a second child, but I feel like I would needed somebody very, I think, nurturing and very calm and
Right.
very chill, and that was exactly what she was.
Okay.
But a couple of other doulas that I had talked with or interviewed, I think we're at that stage of, no modesty, because they've been through it for, personally had kids, and obviously worked with many women who had kids. And while I'm sure they're fantastic doulas, the conversation was just not what I had expected in terms of who I wanted to select for being our doula.
Okay.
So we had a conversation. She came and did an interview with us, and it's again, reflecting on it, so funny because it was such an uncertain time, because I just knew I don't want to have a C-section if I don't have to. I don't want medicine if I don't need it.
Mm-hmm.
I'm an organizational psychologist, and I do research within the healthcare context. So I just knew that I didn't want to be pushed in a way that I didn't want to be pushed. And when we met with her, I didn't know what I wanted. I just knew that I didn't want that.
Gotcha.
So the conversations, I think now reflecting on it, it was like she was having, she was, obviously the more experienced person, so she was trying to get information from us and have us explain and share what we thought birth was like. And she gave us some great resources. So we had kind of initial interview. We selected her, and then she came back for a visit, a more kind of in-depth discussion of kind of our expectations and what we wanted.
Okay.
And, after reading a couple of the resources that she did provide, I was able to kind of get a better sense of, what I wanted or what it would be like. So then during that time was when I was still kind of making that decision of where do I go for my prenatal care, who's going to be delivering the baby.
Okay.
And so there was a lot of phone conversations with her, just kind of talking through the options.
Right.
So there was a lot. I mean, by my memory, we talked a lot.
Okay.
Mm-hmm.
Okay. Awesome. Now, what things did you do to prepare for your birth? Books or classes or videos? What did you do?
All of that. I read Ina May's book on birthing. I can't remember what the name of it is.
I know what you're talking about. Yeah.
I watched the Ricky Lake documentary.
Okay.
There was obviously a couple of other birthing story Netflix movies, because at the time, and I think this was one of the reasons why I never tended to be the person who knew, as a young person, that they wanted children, because I was very scared about birth.
Yeah, and that's pretty normal. Yeah.
So in my mind, now that I knew I had to kind of get over that and prepare myself for it, I wanted to watch all the births. Before, I would never want to watch a birth. Now I wanted to watch all the births I could, so that I could just get used to it and understand it and try to feel connection to it. And hormones are amazing because it works. I started just enjoying watching it and enjoying watching the women and the families kind of going through that process.
Right. Okay.
Took what's it called, prenatal yoga.
Okay. How was that? Did you like that?
I did, and again, it was kind of an interesting, as I reflect, kind of transition into what I liked about it. Because the prenatal yoga, they're all, we're all women at different stages of our pregnancy, and it's very community focused because the teacher does kind of have us sit around a circle, and we share kind of what's going on that week. And I remember the first couple of times I was just very uncomfortable, I was like, okay, this is not necessarily what I was looking for, but I went and kind of joined and contributed. But after, the third or fourth, I mean, it was just that was what I needed and wanted and just loved it. It was really great. And then we did do a birthing class outside of the hospital system. So we did a birthing class that's run by one of the doulas here in Richmond.
Okay. All right. Awesome. So let's get to, what was your birth like?
So our inner house, we were getting, we were getting there, and we had just kind of painted the guest bedroom to make it the baby's room. We had gotten some work done in the basement to get the basement finished, so we had space for guests to come and stay over. And it was a Sunday night, and finally we moved the couch from the living room down to the basement, the bed from the guest bedroom down to the basement.
Right.
And then Monday at 5 a.m., I wake up and tell my husband, I'm feeling cramped. And this was 9 days before the due date. I'm feeling some cramps, and I had some meetings that day, and he had some meetings that day. And he said, what do you need? What do you need to do? And I said, well, I'm going to try to keep sleeping, because it was 5 a.m. I didn't have to get up. My meeting wasn't until 10, so I was like, I'll just keep sleeping. If I have to take it from home, I'll take it from home.
Mm-hmm.
So I fell back asleep. And in my mind, my memory of the birthing class was, as long as you can sleep, you're probably not in active labor.
I say the same thing. Yeah.
So I kept sleeping. I woke up and still had some kind of cramps or contractions. And that weekend before, it wasn't that I was feeling pain that week or any time before then, but that weekend before, I was like, if I'm walking, it's a little more, having to strain a little bit more than normal, or feeling kind of some stretching pains a little bit more than normal, but nothing like that was really kind of getting my attention.
Right.
So I wake up, shower, kind of still feeling it, decide not to go into the office, but take my meeting at home. I'm sitting on a birthing ball, having contractions while I'm on a conference call.
The things that women do, I swear, we can multitask like nobody else.
Right. Well, meanwhile, my husband has canceled his meetings, and we hadn't done everything, so we hadn't like packed a bag, we hadn't put together music, we hadn't put together snacks, we hadn't done any of that. So he was trying to do that, and it was kind of after the meeting, which was about 11 o'clock or 11:30. The contractions were definitely like they weren't close, but they weren't just cramp. It didn't feel like just like menstrual cramp feelings. It was like some true contractions.
Right.
But again,
more intense. Yeah.
I kept thinking I'm going to just try to rest because I don't think it's happening. And I think in my mind I kept thinking, no, he's not coming yet. Still 9 days. So I laid down and kept trying to sleep. And I think it was after the morning or after my meeting. I think my husband called the doula, and so she kind of just coached him. She's like, well, let her rest, try to get her to eat or whatever. And then I kept resting and would keep sleeping, and then started to time things, like it was like 2 o'clock was I think when we started to try to time it. And again, it wasn't consistent. They were still kind of far apart, but I was still having some kind of major pains where my husband would be around the house trying to get things together, putting a playlist together. And every now and then I'd have to call him to try to help me through a contraction or like a hip pain. So I was like, just massage my hip, just massage hip. So again, all the while I'm thinking, no, this isn't really it because it's not debilitating. I'm not saying I can't do it.
Right.
I'm still kind of able to sleep. And we'd call the doula, and my doula would be like, well, let me, listen through some of your contractions. And it wasn't a big deal. She's like, oh yeah, I think you're still a ways away. And I think, in retrospect, I think as first timers, we should have been like, can you just come over? But I think, the doula was making her best judgment in terms of, well, I don't think she's in active labor. So I don't think that, I'm presuming now that I don't think she wanted to come over and then if nothing's really happening, then leave. I think that might have been a little bit more awkward.
Right.
Because maybe once she comes, I think, comes here, I think she wants to be able to stay and kind of see it through it all.
Exactly.
So, but in her way of making that judgment, she would have me kind of, go through a contraction on the phone. And she was like, oh, no, sounds like you're doing really well. You're breathing really nicely. And she's asked me how it was. I was like, I mean, it hurts, but it's not that bad. And I'm still sleeping. I'm tired. And then I was laying down most of the day, actually all of the day. Then I think it was around 4 or 5 o'clock. And my husband called the doula again. She listened through again. And she's like, so, and a couple of times during the day, I know my husband had talked to her and she would tell him to make sure that I'm trying to do like polar bear pose or something else to help with the back pain because I was feeling back pain.
Mm-hmm.
And then it was like 4 or 5 o'clock. She said, there was another time when they talked, she said, well, has she eaten anything? And I said, well, she had some toast and some peanut butter, but she did throw up. And she's like, well, try some soup or something. And she'd been walking around. He said, no, she's just sleeping. She's tired. She wants to rest, to prepare for active labor. And she's like, well, you try to get her up and walk around. So we walked downstairs. I walked out in the backyard for a little bit, ate some like chickens or like brothy soup that a friend brought over from a local store, and sitting on the birthing ball while eating the soup, but just kind of in major contraction pain. All the while still the timing isn't, they're not consistent. It's not happening in our minds still.
Right.
And so now it's like 7 or 8 o'clock and still, I feel like it was a check-in every hour, maybe a little bit more with the doula, kind of hearing me through the contraction, asking about timing, asking about pain, asking about everything. And she's like, okay, well, try to get some rest. She said, she's like, I'm going to get rest as well because I think it's going to happen, but I still think you're hours and hours away from this happening. It was like, I think it was about 8 o'clock when we laid down, turn off the lights.
Mm-hmm.
And turn off the lights. And all I remember laying there for not too long. And I remember we were timing it. So maybe it was more like 9. I remember getting up and just having contractions. And, oh, that's right. The doula did say, call the hospital just to let them know that you're in you're in contractions. And this was post 7 o'clock because Leslie, the midwife, had already gotten in, and we already knew that Leslie was on call or was on service that night.
Okay.
And Leslie was hearing me through the contractions, and she said, "Have you tried to shower, or have you tried contracting in the shower?" And I said, "No." She said, "Try it." And I did. And then that post shower was when we talked to the doula, and she said, get some rest. I think it's going to happen later, but I still think you're hours away. We laid down, and after a while I had this feeling, and then I ran to the bathroom, and earlier in the day, I thought I had lost my mucus plug, but I think I didn't know what I was talking about. I didn't know what to expect, obviously, because then it was at night around, I think it was around 9-ish, that I get this feeling. I go to the bathroom, lose the mucus plug, and my water breaks.
Okay.
We call Leslie. I'm having a contraction. She listens to me go through a contraction. She said, "Okay," it's like, "you're doing well. Sounds like you're dealing with it pretty well." It's like, I think you're still a couple of hours away. So, if you don't feel like the urgency or the need to come in, I think you might be able to labor a little bit more at home. Call your doula, tell her to come over. And then we call the doula, like minutes. We talk to Sarah, and she hears me contract, and she's like, "You need to go to the hospital. There's been a change. Get it packed up,
Right.
go to the hospital."
Right.
And then we get to the hospital. So by this time it was probably around 10:45.
Okay.
And get to the hospital, pull up into the valet, which is now closed. And my husband is unsure what to do with the car. I walk in because I just want to get up to the labor and delivery.
Uh-huh.
The security guard tells my husband that he needs to go park the
Oh my
car.
God.
And the security guard then wheels me up to labor and delivery while I'm like now really having some major contractions where it's like, okay, I can't handle this. This is really getting intense.
Yes.
And get wheeled in and see Leslie, and she's like, "Wow," it's like, "things really got moving fast, didn't it?" Like, "Yeah." It's like, she's like, "Okay, well, can I check, how you're doing?" And she checks, and she's like, "Okay, so you're 9 centimeters dilated, but the baby hasn't dropped yet." So they put me on the monitors, and I think my fear was I don't want to go to the hospital and be like 2 centimeters dilated and then have to just be there the whole day.
Right.
So getting there at 9 centimeters, I was just like, okay, well, sweet.
Off to a good start. Yeah.
Right. And they get the monitors on, and they are putting an IV on, and they can't get a vein for some reason. I think it was a student nurse, and they finally get it, and I guess they identify that the heart rate of the baby has dropped.
Okay.
And they're concerned about that, so they call the OB on call, and they come in, and they're kind of making the decision. My husband, I don't think, is even here yet. Like, this is all very quick.
Right.
And I think after the OB comes in, I think they have me push a little bit. And then all of a sudden my husband comes in. From his perspective, he tells me that he comes in and they're having me to try to push. And he's like, "Wait," because in his mind, he doesn't know that I'm 9 centimeters dilated.
Gotcha.
He doesn't know any of this.
Right.
And he's like, "What's going on?" And the doula got there before my husband did, because I think she knew exactly where to park or whatever.
Right.
I'm trying to push, but the baby hasn't dropped. He's not dropping, and the heart rate goes down again, and they make the decision, we need to do an emergency C-section.
Oh my goodness.
Yep. And so, and I'm just trying to be as centered and as calm as possible.
Right.
Breathing through. And, they're talking to me. I vaguely kind of remember the OB talking to me, and it happened to be an OB that I kind of knew because of the work that I do.
Uh-huh.
So that was kind of nice, because I was always very afraid or concerned that somebody that I didn't know at all would be the one delivering. And he explained it to me, and I was like, okay, whatever has to happen. And I remember being wheeled in to the room. I'm still contracting, painful. And, I'm in the room. I think I was in the room, or at some point, at another point, they said, "Well, the baby's heart rate is up, we could still try to do this. And the midwife's like, I don't know that we can ask her to do this now that we've told her, we're going to have to do an emergency C-section. I don't know if she's like going to be able to push or do it. And in the end, I was just like, just do the emergency C-section, get the baby out.
Okay.
And I just remember asking, why is this taking so long? Because I knew what it meant in terms of an emergency C-section, that they were going to have to put me under and then get the baby out. What I didn't realize is they need to have everything ready so that it's a quick put me under, get the baby out, so that there's no transfer of
the anesthesia to the baby. Yeah.
Right. So I just remember like screaming out, why is this taking so long? Why is this taking so long? And all the while, my husband tells me that he's outside the room because he can't go in the room. He's with the doula, and he just doesn't know what's happening, or just doesn't know what to do. So then emergency C-section happens, and
so you went under general anesthesia.
Yeah.
Okay.
Mm-hmm. Yeah. So I was completely out, and then the next thing I remember is waking up in the delivery room, or in the room, not the operating room, but the delivery room, and being in pain, but also being like, where's the baby? Where's the baby? So then we got wheeled over to see the baby for just a few minutes. I'm completely groggy, but at the same time very excited. And it's kind of an interesting picture. The first picture, because he's, they obviously went and took him to make sure he was okay.
Did he go to the NICU or just?
He did go to the NICU.
He did. Okay.
Mm-hmm. And then I remember the picture that we have of him kind of in the NICU. He's got a little, I think, IV, because he had a little arm brace or something to keep his arm straight, or maybe not IV. He had something on his arm. I think it was an IV, because he had a little arm brace on it, a little thing, and got seen for a little bit. But then, so he was born at 11:45 on a Monday night, and we got wheeled back up to the room around 1 a.m. And then by 6 a.m., my husband was downstairs to figure out when he would be able to come up. And they finally came up about 10 a.m., even though I was still kind of post-surgery and still very groggy.
So were they let him out of the NICU, you mean, to come up with you? Or
Right.
Okay.
Mm-hmm.
Okay.
Yeah.
Okay. I'm just over like, what was that all like for you?
It was, during the moment, it was very, okay, I just need to stay calm. I'm in pain, so I'm just going to breathe out, just let it happen. Like there was never a concern, or there was never fear that something was going to go wrong.
Okay.
I don't know if in the moment I kept, because I know now that babies' heart rates drop when you contract. So I didn't know, for whatever reason they were saying we need to get him out. I think in my mind, I thought, well, he's not dropping. There's the three stages that need to happen, or the three things that need to happen for a baby to birth. I'm obviously dilated, but one of the things is that he needs to drop, and the baby hasn't dropped. So, okay, fine. Then I didn't know what that meant in terms of, and I knew my water had broken. So I think in my mind, I just thought, okay, well, he's not dropping. The baby needs to drop fast or soon. So maybe that's why they're making the decision to do this emergency C-section.
Right.
I think post delivery and post me not being groggy, but like maybe later that day on that Tuesday, it was really upsetting that it happened that way. But I think it actually wasn't, it was upsetting, but it wasn't interfering kind of with my joy and love, for finally meeting the baby.
Gotcha.
But our doula came to the visit post birth.
Okay.
And
in the hospital or at home?
At home.
Okay.
So he was born on a Monday night, and we didn't leave because we actually took the extra night
yeah.
that they offered. So we didn't leave until Friday. And our doula came and visited us on Saturday. And, I was still kind of processing it.
Right.
And she, she didn't know that she didn't know that I necessarily studied kind of collaboration and did it in one of the contexts being healthcare. And so when I told her that, she's like, I didn't know that. I was like, that's so interesting. That's kind of, because from her perspective, she kind of saw what was going on, between the midwife, between the OB, and how they were working with the doula, how they were working with me as the patient and my husband as a family member. So even though the outcome wasn't what I had expressed to her, she kind of saw how everybody was working together and working well together.
Right.
But I think the other thing that she kind of highlighted or honed in on was that the full day that my husband and I spent at home laboring and how well we did it together. Like how we felt, the support from one another, and how awesome that was.
Oh, that is so beautiful.
It is, and it is that. It is like, okay, we can do this together. And that's, to the point where we never said, hey, Sarah, come over.
Right.
Because I feel like if she would have come over, she would have gotten me walking, and maybe that might have helped to get him dropped, but I don't know. But for whatever. But I think hearing that description was like, oh, that's pretty special and pretty awesome.
Absolutely. So she just helped you to find a way to kind of process everything to where you could see like the positive aspects of it.
Yes.
Yeah. So what other things did you do to manage your feelings about how your birth didn't go the way you anticipated?
I definitely talked about it. I wanted to share it because I think after Sarah had explained it that way, I was like, I want to share this story. Like, I just want to talk about it. And, it's funny because, then I became the woman that wanted to talk about her birth. But it's so just kind of an awesome experience, and an awesome experience to be able to be home and just kind of be, here in a safe space and feel comfortable and feel supported, and just kind of allowing my body to just kind of communicate what it was that we needed at the time, or that I needed at the time.
Right.
So I did a lot of talking about it, and my husband and I talked a lot about it. And
did you ever talk about it with your midwife or with the OB physician?
I did, because I had a 6-week post-birth visit with the midwife. And I feel like I had another visit with the OB. But yes, we did talk about it with the midwife, and my husband was there at that visit too, and we talked about it.
Okay.
And then I even talked a little bit more about it with the OB, because I do remember him kind of looking up some tests in terms of helping process or helping communicate kind of the decision or the thought process of doing the emergency C-section.
Okay. Do you think that was helpful?
I do. I still think it was, I feel like if I would have that conversation now, I would be asking different questions or more questions.
Mm-hmm.
I think at the time I was still kind of, didn't know what I wanted to ask or wanted to find out.
Right.
But yeah, I do think it was helpful.
And do you think that 6 weeks was too long? I think 6 weeks is too long to wait even if it's like you check in just a little bit. I think we need to do better about seeing women earlier. What do you think?
Oh, I agree completely. I think the fact that the doula had come twice was helpful. Like, from getting discharged to the 6-week visit, I at least saw the doula twice, and I think that helped with that kind of transition. But I do think it's too long.
Yeah,
I think we need more support for women and families in that kind of transition period. It's a huge transition.
It is a very huge transition, and it's something that you just can't appreciate until you go through it. So, yeah. So, looking back on all of it, how do you feel about it now?
I love it. I mean, yes, I'm disappointed that it was an emergency C-section. As I kind of just shared a minute ago, I do wonder that if I would have walked around, maybe he would have dropped. But in my mind, I was thinking, if I can sleep, then I'm not in active labor. And so I was resting in preparation for the walking that I thought I was going to have to do.
I think we all have those sometimes, when things don't go the way you anticipate, that wonder if you would have done things differently. I mean, for I had a C-section for my first and a C-section for the second. And I'm like, oh, what if I would have tried to VBAC? I never had that experience of a vaginal birth. So I think that's common that you have that sort of what if kind of thing, and you just figure out a way to deal with it.
Right. And I wonder, I think my reflection on it is more about missing kind of his entrance, right? Not
Yeah,
necessarily the experience of the vaginal birth.
that
I
makes
think
sense.
it's more of like, I was knocked out, so I didn't get to see him come out. I didn't
Right.
get to hear him come
You
out.
didn't get to
I
hear the
didn't,
first cry or that kind
right.
of thing. Yeah.
I didn't get to, do skin to skin immediately.
Right. Right.
All that kind of stuff. So I think
Gotcha.
it's that, and again, I think hormones are an incredible thing because I think that's what's helped rationalize it for me because I early on, the first few days and the first couple of weeks, it was devastating and it was hard,
Sure.
but I think I was able to, and like I said, I love sharing the story. I think it's a a unique story to share, but I do love talking about it, even if it wasn't exactly what I had hoped it was.
Yeah. Yeah. Now, what was your physical recovery like? Did you have any issues there?
Not really. I mean, it was tough. It was funny, or not funny, but it was interesting. While I was in the hospital, I would be in pain, and so it, now I guess is typical. They had me walking. I believe it was that Tuesday. So it was within, if not at 24 hours, they had me walking at least a little bit,
Mm-hmm.
and so it was painful. The and when I was in the hospital, they were like, "Oh, so how you doing with pain?" I was like, "Well, I'm still like in pretty good amount of pain. It's not debilitating. I mean, I'm still able to hold and try to nurse and everything, but it still hurts." And the nurse, I guess, looked at my uh, how much medication I was getting because they gave me the self monitored medication, and they're
Mm-hmm.
like, "Oh, well, you're not giving yourself any medication." It's like, "Oh, well, maybe I need to have a little bit." So I was able to kind of manage the pain a little bit better in that way. But the more I walked, the better it was. I think also when I got home, I had mixed up how to take the medication because I do remember one night just waking up in excruciating pain,
Mm.
and I think I had, you know, something like I could have taken it every 4 hours. I think I had to take it every 8 hours or something like that. But it was tough but it was really, in terms of my memory, it was only really one night of being in big pain. I do remember walking around the block. It was either the Sunday, so yeah, it would have been almost a week. Yeah, he would have been almost a week. It was a Sunday. Some friends came over and we just took a slow stroll around our block.
Okay.
So
Okay.
tried to get up,
Right.
and that was really kind of encouraged by a friend who had already had two kids, and she was like, if you feel up for it, we can go take a slow walk.
And get some fresh
And
air and that
yeah,
kind of thing. Yeah.
yeah.
Yeah. So looking back and then just kind of to wrap up, what are some things you wish you knew beforehand? Or is there anything you wish you would have known beforehand?
No, I mean, I don't know that I missed any information that would have helped. I think the one thing I wish we would have done, and so it's not necessarily knowledge, but it's more of a behavior and action, is I wish we would have asked the doula, you know what, can you come over?
Mm-hmm.
Just,
Even
even
if you leave later, just to,
if you leave later,
yeah,
just come over.
right.
But I think that's really the
The
only
one thing.
thing. I mean,
Okay.
I think it would have been nice to have had a plan, like, okay, yes, you can rest, but I took it to the extreme, right? I was like, as long as I can sleep, then I'm not in active labor and I'm just going to keep resting.
Got it.
But if I could have had a plan to be like, okay, keep resting, but you need to walk up and down the stairs, or you need to walk around the block and then come back and rest, or something like that.
Gotcha. Okay. All
Mhm.
right. Oh, and I forgot to ask, how do you feel like the combination of a doula, midwife, and then having an OB, how did that approach work for you?
I think it was. I mean, I think it worked. I think the the having the OB kind of come in, unexpectedly, and but because of a concern, I'm glad that there was that option, or that, I'm glad that the midwife was able to lean on her colleague in that way
Mm-hmm.
for that time. I think the OB and learning this post visit, because we talked some, they are open and they are very receptive to that kind of collaboration with midwives. So it was nice. I think that's a testament to kind of the program that has been built.
Well, good. Awesome. So last thing, just to kind of finish up, what is one thing or one piece of advice that you would tell women who are getting ready for their birth?
I think my one thing is would be to connect, like to reflect and connect with what it is that they want to experience for themselves. Ignore the stories out there, ignore the celebrity birth videos. What is it that they want? And to really, if they're not a reflective or spiritual type of person, to at least consider reflecting in this moment of their lives.
Oh,
because it's such an amazing experience that, we often, I think, focus on the outcome rather than the process. And I think that's essentially what I'm suggesting is think about your process, think about what it means to you, and really think about it and not just rush through it.
yeah, I really like that a lot. This is not going to be a time that necessarily comes around very often. So
Right.
take a moment and just reflect and connect with what's important to you. And like you said, not just for what you want for the birth, but just enjoying that moment of pregnancy and really connecting with it. I think that's really, really great advice.
Yeah. And I know that all of this is essentially in my second career. I would love to be a doula and help support other women.
Ah, interesting. How did you come to that conclusion?
I think it's just, what Sarah did, I think, for like the support that she provided me and the support and just the conversations that she had with us. I think, if I can do that for other people, because I, just reflecting on how I thought about the process and how I kind of, was afraid about it at first. I would love to help women through that and kind of think through it and act through it and be in that process with them.
Right. That's awesome. That's a really beautiful thing to do. I think as women, we need to try and help support other women as best we can during pregnancy and birth, because unfortunately our society, we don't have it set up very well, at least from a medical system perspective of supporting women, especially after the birth.
Right.
Yeah, for sure. Well, thank you so much for agreeing to be on. I really appreciate you coming on and hearing your story.
Well, I'm thankful that we got connected and look forward to hearing other stories. And thank you for what you're doing to kind of share the different stories of what birth can look like.
Yeah, thank you. And then I don't know, you can totally say no to this question because not everybody is, but are you on any social media or anything where women can connect with you afterwards, after they hear you on the episode? Not everybody is, but I always ask.
I am. I mean, I have a Facebook account. I have a Twitter account. I'm on LinkedIn.
Okay. Well,
they can be connected at any of those.
Okay. I will link to all that stuff in the show notes. And again, thank you for being here. I really enjoyed it.
Thank you, Nicole.
Okay. All right. Bye-bye. So what did you think? I really enjoyed that. Although Debbie's birth didn't go exactly the way she hoped, she's very proud of her story, and I love that. Now, after every episode where I have a guest on, I do something called Nicole's Notes, where I talk about just my top 3 or 4 takeaways from the episode. So here we go for this episode. Number 1, and this one's a pretty quick and easy one. Do a dry run of where you're supposed to park at the hospital. When she talked about how her husband didn't know where to park and all that kind of stuff, that was like, oh, painful. So especially if it's a big hospital with lots of different places where you can park, do a dry run so that at 3:00 in the morning, if you're driving to the hospital, you know exactly where to go. Number 2, I loved how Debbie was comfortable with changing providers when she felt like the first one, her physician, wasn't right for her. Of course, I'm not saying all physicians are bad. I'm a physician myself. And it's not necessarily that all midwives are great. Each individual person has their own unique style of practice. But the important thing is to find a doctor or midwife or whoever who works best for you. And that was really awesome that Debbie made that change when she felt like she wasn't in the right place with her first provider. Number 3, Debbie said she was afraid of birth, but she knew that to get over that fear, she had to inform herself. So she hopped right on in, got the information, got books, watched videos, all of those things, so she wouldn't need to feel afraid of the process. And I encourage you to do the same, whether it's books, videos, a good childbirth education class, like my online childbirth education class, the birth preparation course. Definitely prepare yourself so that you don't fear birth. And then the last thing I'll add that I kind of picked up on is to be comfortable asking for what you need from whoever that is. Although Debbie obviously had a good relationship with her doula and she liked her doula, she wished that she would have, in hindsight, asked for her to just come over. So this is just a little reminder that not just from your physician, but everyone who's involved in your care, be sure that you are comfortable asking what you need from them. All right, so that's it for this episode. Be sure to subscribe to the podcast in iTunes or wherever you listen to podcasts. And I would love it if you leave a review in iTunes. It helps other women find the show. And I also give shout outs on episodes for folks who leave me those reviews. And don't forget to sign up for my live online class on how to make your birth plan. This is going to be so super informative and helpful. And I'm so excited to be doing it live so I can be there with you. Register at ncrcoaching.com/register. Now, next week on the podcast, I have an amazing prenatal yoga teacher coming on to talk about prenatal yoga. She is so super passionate about what she does, and she even created a bonus video to go along with the episode. So come on back next week. And until then, I wish you a healthy and happy pregnancy and birth. Today's episode is brought to you by Women's Wellness Coaching by Dr. Nicole Calloway Rankins. Head to ncrcoaching.com to check out my free 1-hour mini course on how to make your birth plan, as well as my comprehensive online childbirth education class, the birth preparation course. With over 8 hours of content and a private course community, the birth preparation course will leave you knowledgeable, prepared, confident, and empowered going into your birth. Head to ncrcoaching.com to learn more.